Good morning, everyone. It is Thursday, March 17th. Welcome in to the Morning Medical Update. Thank you so much for joining us here on Facebook, YouTube, and now on Twitter. What is metastatic disease and what happens if it spreads to your bones? Dr. Kyle Sweeney is joining us. He is a specialist in musculoskeletal oncology and reconstructive surgery. He's going to explain more about that and the latest treatments available to patients going through this. Plus, we're going to hear from one cancer patient on how her care is helping her live a much happier life. In this morning's medical headlines today, a simple blood test may predict long-term risk of type 2 diabetes and cardiovascular disease. It's something called lipids. Researchers say profiling lipids may be a cheap and easy way to predict risk, allowing for changes to diet and lifestyle before conditions develop. You may not have a green thumb, but you may want to add a houseplant or two. New research from the University of Birmingham finds houseplants may be beneficial at improving indoor air quality by reducing indoor air pollution levels. Researchers say corn plants, peace lilies, and fern arums were able to cut the pollution levels in half within an hour. Increased social media use among teens during COVID-19 is now linked with tic disorder severity and reduced quality of life. The study by the University of Florida found most people in the study used social media for up to 6 hours a day. Experts say the teens are following the actions of social media influencers while also battling anxiety and depression. A few road issues in one part of the metro through the weekend. A live look at I-435 near K-10 in Johnson County, where crews will begin demolishing the Renner Road Bridge over the interstate. This will start tomorrow. That means I-435 will be shut down starting tomorrow night at 8 and will last until Monday morning. KDOT will have detours posted, and those will take you along I-70, I-635, and I-35, so allow yourself some extra time. Get your questions sent in to us on YouTube, Facebook, and the Medical News Network. You can find links to all those right there on your screen. All right, now it's time to get to Dr. Dana Hawkinson this morning. Keeping it a little casual. How you doing over there in your green and you're representing KU and all the good stuff?
They play tonight, so
yeah.
Good luck to them. Hopefully they will get a win.
Yeah.
And it is St. Patrick's Day, so we're gonna kind of just do this and be in this the spirit. But we have right now 18 active infections, so we're up a little bit from where we were yesterday. 1 in the ICU and 1 on the ventilator. Overall, 67 in that recovery period as well, so 85 total. But again, not too good to see an uptick in the number of cases. I think we just need to wait for the next few days and see how that trend is.
All right, Doc Hawk, thanks so much. Do we have any reporter questions on the line today? All right, I think we're good. We're clear. We're going to get on to our topic, and that is bone cancer. It can begin in any bone from the body, but it commonly affects the long bones in the arms, legs, and in the pelvic area. Primary bone cancer is the most serious of all bone cancers as it forms directly inside the bone or in bone-derived cells and tissues. According to the website Healthline, primary bone cancer is it's not common and accounts for less than 1% of all cancers. But for those who do get it, the University of Kansas Health System offers hope thanks to some incredible, innovative surgical care. Dr. Kyle Sweeney is joining us this morning. How are you today?
Doing well.
All right, good to see you. And also, we have patient Mary Alice Weimer. She had breast cancer, and then it spread to her bones, and she's going to share her story with us and how she's doing today. So good morning to both of you. Mary Alice, how are you doing?
Doing great. Thank you.
Good. So nice to see your smiling face. Tell us just how you're feeling today. And then I want you to kind of take us back to 2017 when you were first diagnosed with stage 2 breast cancer.
Actually, I'm feeling quite well. I continue treatment. I'm doing oral chemotherapy now, but hopefully the big major things I need to do are behind me and I am moved on with living my life.
Well, we'd love to hear that. So back in 2017, you were diagnosed with stage 2 breast cancer. Tell us a little bit about that health journey and then how you found yourself on the right path, but then doctor said not so fast.
Okay, actually, I was diagnosed with stage 2 cancer in 2000.
2000, okay.
In 2000, right. And I went through all the treatment, a mastectomy, radiation, chemo, and spent 17 years not really thinking much about cancer other than doing my routine follow-up treatment. And in 2017, after losing some weight and developing some odd pains, I had a back x-ray, which determined that my bones looked moth-eaten, and further testing showed I had metastatic breast cancer that had moved to both femurs, my pelvis, my spine, and I have a few spots in my liver.
So before you got to Dr. Kyle Sweeney, who we're going to talk to here in just a few moments, what were doctors telling you? They weren't as concerned as maybe you should have been, right?
No, they weren't. In fact, I had been treating and had blood work done. And in fact, I did my follow-up with my oncologist, and I just kept plugging along. I mean, it didn't stop my life any. I was still doing my job and living my life. And when the pain became so unbearable, it was sort of an afterthought that maybe we should do a back x-ray, and that's where this turned up. My doctor, my primary care doctor, even said, I can't believe there's anything wrong with you.
Really?
So, and there was.
And there was. So, Dr. Sweeney, I want to bring you in here. What kind of condition was Mary Alice in when you two met?
Right. So when she came into my clinic, I remember, Mary Alice, you were not very comfortable. Quite a lot of pain in the back, quite a lot of pain in her leg and her hip. And so, and we had some imaging that had been done at your previous visits with your other doctors. And so we sat down, took a look at it, and really had a challenging discussion. I remember you were very surprised to hear what I was telling you, but it looked like the breast cancer had come back, unfortunately.
But I would imagine, Mary Alice, that was some type of a relief to have Dr. Sweeney actually telling you there was something wrong and we're going to put together a plan to help you get better.
Right. Actually, my oncologist sent me to Dr. Sweeney when everybody determined there was something wrong. It was just at a point where nobody exactly knew what it was that we should do. And I do remember seeing him the first day and thinking about how bad I felt and thinking, well, this all sounds well and good, but I'm too far gone. This is not for me. I can't imagine anything helping.
When Mary Alice told me she had moth-eaten bones, what does she mean by that? What kind of condition were her bones in?
Right. So, I mean, when cancer spreads to the bone, it can do multiple things. It can sometimes create abnormal bone, but most of the time it can eat away at bone. And so her specific type of breast cancer was one that was a little bit more destructive than others. And so she had, we describe it on an x-ray as moth-eaten, in that there are little holes kind of everywhere that gives the appearance like a moth got after a piece of cloth. So that's essentially what that term means.
So I'm surprised when I hear her tell me that she had cancer back in 2000. She's gone 17 years taking care of herself, doing all the things that doctors tell her to do, and that when she came with all these issues and kind of knowing her own body, said, I don't think something's right, that wouldn't have been the first thing they would have thought, that they wouldn't have maybe investigated a little bit more, that it finally took getting to you before you were able to get to a diagnosis and get to treatment.
Yeah, I mean, most metastases happen sooner than what Mary Alice experienced, and so I don't want to be too hard on anybody else. But I will say that, once we had the imaging and once we had her, here, then we could make that kind of full comprehensive plan. I can talk to the medical oncologist that we have here, and we can come up with a plan to move forward and to make your life better.
Well, I appreciate you saying not being too hard on other people, because that's why we exist, because we're able to put together this comprehensive plan, and not to talk over people's head, but kind of understand, help people understand what that really means. Somebody could go to another doctor, but then was referred here because we could dig a little deeper.
Right.
So talk us through what kind of plan you put together for her.
Yeah, so when someone comes in when they have metastatic bone cancer, there's always a lot of moving pieces. In other words, you have to think about the systemic therapy. Are they going to be on chemotherapies or immunotherapies? You have to think about how that impacts a surgery. You have to think about how to treat that specific, say, disease that's in the bone. Now, Mary Alice, she ended up getting one of the more common sort of surgeries that we do for this, which is putting a rod inside the femur to protect it from breaking. But as medical advances are being made and as people are living longer and longer, the treatment for metastatic bone disease is shifting quite a bit to a little bit more specialized care. The old way of thinking of it was, well, someone's got metastatic disease. I don't know how much time they have left. It's probably not much. Let's just put something together to make their life a little bit better. But that's not the paradigm now. And the treatments that we have and the prognosis that Mary Alice you have means that we need to be a little bit smarter and a little bit craftier about how we treat these sort of problems.
I'm glad you said that, because the word metastatic has taken on a new meaning. You're right. It doesn't mean the end of the road. It just means we now have to find new treatment in new ways. So who would be a good candidate for a prosthetic or an implant? You said Mary Alice was for implants, correct?
Mm-hmm. Correct.
Tell us a little bit about those treatments and what they entail, and who might be a good candidate.
Right. So I mean, if a big part of it is me talking to you, doing an exam, figuring out where your pain is, how much that pain is, when you're having your pain, what those activities are, and then correlating that with imaging, whether that's CT scans, MRIs, X-rays, and then figuring out from there, are we at risk of something breaking? Are we at risk of having an event that's going to dramatically impact your quality of life? And so in the case of Mary Alice, she was at a really high risk of breaking her femur. And so in that case, we can stabilize that femur. I actually today, after I leave here, I've got another patient with breast cancer that has the entire top of their humerus, including their shoulder, is almost gone. And I can't just stabilize that. So for that's more of a specialized surgery. We're going to remove that bone and put in a really big prosthetic, but reconstruct that shoulder and give that person who's in a sling and in terrible pain the ability to move that shoulder again and to use it. So those are relatively new implants that we're using and new designs that allow for that kind of function.
So you're saying things would have been much different for Mary Alice had this been 10 years ago, perhaps?
I think so, yeah,
treatments.
Absolutely.
So how do you feel with the implant? Talk us about your quality of life.
My quality of life is great. In fact, the morning of my surgery, I remember Dr. Sweeney coming in and saying to me, I can't do anything about your cancer, but I can give you a quality of life. And I have to say, honestly, I'm not sure I believed him, but he was right. I have a very good quality of life. I was able to go back to work for the Kansas City Chiefs. I work part-time for them, and I'm able to do my volunteer work. I volunteer with North Care Hospice, and I have become a fourth angel through the Cleveland Clinic program, which is a mentoring program for other women like me in my age group who have metastatic breast cancer, and they live all over the country. I talked to a woman on Cape Cod, and I talked to a woman in Washington State, and it's become quite a little club that nobody wants to belong to. But I have a very good life.
Mary Alice, being involved in helping these other women and people all over the country, how much has that helped in your healing?
It helps a great deal. I'm supposed to be the mentor, but I find that they help me just as much as I help them. We share our common concerns and we share our common joys, and we have learned that don't take any day for granted, and do what makes you happy.
Yeah, that's the way to do it. Let's go back to some of those Chiefs pictures, because we always like to talk about the Chiefs around here. So I know you said you worked out there and you were feeling good just in time to enjoy the celebration of. I love this picture, by the way, right here. I love a good mustache. A good Andy Reid look for you.
Thank you. That was Mustache Monday at training camp. Travis Kelsey came up with that, so we decided to join in the fun.
I love that. And that has to certainly kind of be a big shot in the arm and help get you through. I'm sure being around those folks has really been a joy for you.
They are great. They were wonderful to me when I was sick. I didn't work the whole 2018 season. Went back in 19, welcomed me with open arms, and I did get the opportunity to thank Andy Reid for waiting until 2019 to win the Super Bowl, because if they'd have done it in 18, I would have missed it.
It was all for
And
you.
so, I've told him I appreciated how much he cared about me. So they're
so
great
what role?
people.
I love that. What role do you play out there at Arrowhead? What do you do?
I'm in their guest services department, which means it's kind of a fancy name for an usher. And I have a very nice section. I have a number of the player families in my section. And I also am on their event staff. They do a lot of special events. There's a lot of meetings, and KU comes out quite often and holds meetings, and I'm able to help out there.
So you are living your best life. Very fun.
I am sure trying.
Thank you for sharing those fun pictures with us. We have a few questions coming in from our community, so I do want to get to those if we could. Dr. Sweeney, can you explain exactly what metastatic disease is, and does it only come from certain type of cancers, or if you have cancer, you're always susceptible to that?
So most cancers, I mean, by the definition of it being a cancer, it has the ability to spread outside of the initial site that it started. And so when it spreads to somewhere else, that is metastatic. It's considered metastatic disease. Whether or not it goes to bone is a different discussion. You know, there are certain types of tumors that are more likely to go, things like breast, prostate, lung, kidney, and thyroid. Other types can go to bone, but those are the 5 by far most common. But other types of cancers like GI cancers can spread to other organs even if it's not bone, and that would be considered metastatic.
So after your post-treatment with cancer, are they always going back to check to make, how does that, what is the post-care, and what kind of screenings are you going through to make sure it doesn't turn metastatic?
Yeah, that's a great question. So that's where we typically, oncology clinics and my clinic for, sarcoma, we have survivorship clinics. Mm-hmm. And so with that survivorship clinic comes CT scans or x-rays or PET scans, and really it depends a lot on what that specific type of cancer is, what the risk of spread is, and where the risk of spread is. And so we try to tailor the surveillance and the survivorship clinic to the specific disease.
All right, Jean wants to know, what are the treatments for pelvic area bone cancers? And Kim had a similar question. How is cancer in the bone marrow treated?
Right, so in the pelvis, this is definitely a developing field, and we're doing some really exciting stuff here now. I partnered with Dr. Brent Wise, who's actually one of our trauma orthopedic oncologists. We never thought I would drag him into the world of cancer treatment, but there's new implants where we can go minimally invasive, put a balloon inside the pelvis, inflate that balloon with a monomer, and then it's just like the blue light you see at the dentist that solidifies like a filling. We've got a blue light that goes in and hardens that balloon, and so you can put these large balloons through the pelvis through tiny incisions to support the cup part, the acetabular, or the cup of the ball in the cup, and that can prevent fractures. So in the same way that I was able to do a minimally invasive surgery on Mary Alice, we're now doing that in the pelvis, which we didn't really think that we'd be able to do as much. And it ranges everything from something minimally invasive like that to oftentimes there's a lot of bone missing in the pelvis, and so I end up having to do either a custom implant or a sort of a custom reconstruction of a pelvis to give someone the ability to walk back.
So again, my question is, without these advancements, where would somebody have been 15, 20 years ago? What would the treatment have been?
There's
literally sitting around waiting?
Yeah, there's not as much. There were still, you could still had some options. They've been doing a little bit more crude pelvic reconstructions for a very long time. But it's just that the implants are advancing and the techniques are advancing to the point that I think that we're able to do a lot more now than we used to be.
So what's it like to see Mary Alice here? She looks healthy, she sounds healthy, she's got such a great spirit right now. What's it like though, just to be reconnected with people after you kind of on the other side?
Right. That's what keeps you going. This is why you go into medicine, I think, as a physician, and relationships with people like Mary Alice are incredibly rewarding. And when she comes back, I can see how well she's doing, and she tells me about about Mustache Mondays in clinic, and I'm wearing the socks you currently gave me, and I appreciate that.
What are the socks? What do they look
they
like?
are. Well, I can't.
Can you
I don't
see
know if
a
I
big
can-
white
they're,
shot?
They're
Yeah.
Superman socks.
Oh, I love Superman. That's awesome.
So
Fantastic.
I appreciate that, and so yeah, it's just those kind of relationships are special. They really are.
Those stick with you.
Yeah.
Not the cancer. That these relationships stick with you. I love that. But Betsy wants to know: would there be indications of bone cancer in blood work, or does it take an X-ray to indicate that?
Yeah, so that's another great question. It depends on the cancer. There are things like prostate cancer, which has your PSA levels, and there are other markers depending on the tumor. Oftentimes there's not, though. With breast cancer, there isn't. Or at least nothing reliable. And in Mary Alice's case, a blood test would not have told her that she had something. So a lot of this it's found in two ways. I think that's the root of the question, right? And
Right.
so the first way is through routine surveillance. And so that survivorship that we talked about, getting the correct imaging and getting it on a regular basis to check to find anything early. And the other thing is just being aware of your own body. And if you know that if you have had a diagnosis of a cancer and you're developing back pain, if you're developing hip pain, it's probably not cancer. But you still need to get that checked out because it could be.
Right.
And when you have that history of the previous cancer, you can't ignore that, even if it's 10, 15, 20 years prior.
Isaac wants to know. He follows our proton therapy center that's going to be opening, and he always wants to know when we have somebody on who handles our cancer patients, will proton therapy be able to be a treatment at all for people with metastatic bone cancer?
I think absolutely. And Dr. Ronnie Rotondo is kind of heading that up, and he would be able to answer that question much more eloquently than I. But I will tell you that we are really excited about that center. The proton beams are remarkable in that they can almost dial in exactly where the energy from the radiation goes, and so you're not getting all this scatter effect, and you're not getting all of the bad side effects that can come with standard photon radiation. And so when you're able to target things more accurately, you open the door to getting higher levels of radiation into smaller areas. And radiation is still very much a mainstay of the treatment of metastatic disease and the treatment of metastatic bone disease. And so we are really excited to have Dr. Rotondo leading that charge and helping open that center.
And Dr. Ronald Chen, yes. So we're very excited. We're just weeks away from taking our first patients and making appointments. So it's a really exciting time around here for that. So I have a question, Dr. Hawkinson. Let's get to you on something. Melissa wants to know, does Doc Hawk have any updates on under 5 trials? Just in general, any updates about when kids under 5 might be getting the shot in the arm?
Yeah, I think we're still waiting for that. I don't have any more information. I haven't seen a lot of information in the news. Mostly this week or so, this past week, it's been a lot about adults and a 4th booster. But I haven't seen anything for getting those younger children vaccinated yet, or what the status, if there's any change in the status. I mean, I know they're still collecting data and doing all that.
But that's one of those we had to ask kind of questions,
Yeah,
for sure.
absolutely.
Okay, so
I think it's important.
Yeah, Isaac has another one for you also. Does prior infection from BA1 provide protection against BA2? I read that reinfections from the latter after the former have been seen, but are somewhat uncommon.
Yeah. I think there is still differences or changes in the spike protein enough so it can't evade those antibodies from Omicron for BA1, so you can get reinfected with BA2. We know we're seeing that. But to what extent, it's very difficult to say. But more importantly, it's not necessarily infection that we have concerns about. It is more of the disease, so the disease spectrum. And when you've had infection and multiple infections or vaccination and infection, we know that you have gained immunity to help reduce your chance of going to the hospital, to help reduce the more severe cases on that disease spectrum. So it's not just about infection, but it's more about that disease process. But we know that you probably can be infected, but to what extent, I don't think we know that for sure. But we have seen infections with people who had Omicron and then did get BA2 as well.
Mary Alice, when we spoke on the phone, you said that you and Dr. Sweeney had a loving conversation about how neither of you really want to see each other in the office anymore. And you meant that in the most kind, loving way. So just talk to me a little bit about what those conversations have been between you two.
Well, I haven't seen him too often. It was amazing for what sounds like such a major surgery. I had 3 little incisions and was up walking the same day as the surgery. And I think I did 2 or 3 follow-ups, and I haven't seen him probably for a couple of years. And then I had a little blip on something right at the end of the year. So I recently saw him after the beginning of 2022, and he walked in the room and told me he hoped he'd never see me again. And I told him that I was sort of feeling the same way, but he's a very nice guy. So
Yeah, so take a good look at him right here. Hopefully this is one of the times you're going to see him for the last time.
well, no, actually, I see him next month.
No.
Oh, good. Okay.
Yeah.
Okay. Well, so tell me a little bit about that. I wanted to lead into that, because what is the treatment or the checkups going to be like for someone like Mary Alice, that now that she has this implant and she's doing better, but we're going to keep a close eye on her?
Right, so that's always a balance, because I want to make sure that we're not missing anything, but I also want to make sure I'm not being onerous on patients and having them, they've already got 1,000 visits with all kinds of doctors. So it really is tailored to the patient, to the implant, to the surgery. In Mary Alice's case, it was something that her pain was relieved from that surgery, and pain in and of itself is how we watch it. And so if she ever develops any discomfort, and I tell her that every time we come back, well, I don't have a scheduled appointment for you, but I expect a phone call if anything is happening that you don't feel like it should be. And so then we can get people back in. So other times we do follow people annually or semi-annually with x-rays, but it just depends on what we did.
But Mary Alice is a pretty good patient. She's going to let you know, right?
Exactly, yeah.
Well, and I think it's nice because you're putting the control back over to the patient and letting them kind of guide, and they know themselves better than anyone. This is a good question from Bridget. Does the Cancer Center have a nurse or doctor line for family to discuss second opinions due to care that they have received somewhere else or information that they've received from another physician? How do we help connect them with us?
Yeah, that's a great question. I mean, it's just calling in. We do have that set up. I give second opinions all the time on whether it's metastatic disease or it's primary sarcomas. Or it's just a lump or a bump that someone's really worried about. Right. So we get second opinions all the time, and we've got the system set up that if you do call in to make an appointment, we've got nurse navigators who are fantastic. So each of the cancer service lines has a nurse navigator. It's a nurse who is dedicated to bridging that gap between the patient and the physician, getting all the records, making sure that we have everything that we need, getting appointments, coordinating. I mean, they're fantastic, and they send me emails and messages all the time to make sure that we've got everything that we need leading into the appointment. So we have that system in place if that's something that you would like to seek.
And I love what I've heard some of our cancer doctors say, that sometimes we are the second opinion, and sometimes we send you out for the second opinion, because it's really about making the patient feel comfortable about the treatment they're receiving. So
absolutely. And I would just add, there's also, as you get second opinions here, sometimes very often actually, we end up coordinating with community oncologists and radiation oncologists to help people get care where they are. I mean, we don't expect someone from Hayes, Kansas to drive up here every single day for a few weeks to get radiation, but we can still provide that level of expertise. It's a little more difficult with surgery. I can't just direct someone how to do surgery, but with treatments that don't necessarily require that, we often do coordinate.
That's a good point. Glad you brought that up. Okay, we are going to get to some final thoughts. And Dr. Sweeney, I'm just going to let you get us started, just kind of what you want us to know, and certainly the importance of screenings and staying in touch with your doctor and knowing your body.
Yeah, actually, I would say what I would say is that if you have a diagnosis of cancer, what you need is a comprehensive plan. And oftentimes in the past, we have different specialists that are in their own silos. You have your radiation oncologist, your medical oncologist. You got this whole team of people, and are they talking or are they not? And I can say that one of the things I'm so proud of here, and one of the things I love about being here, is that I have a personal relationship with our medical oncologist, with our radiation oncologist. We have each other's phone numbers. We talk about patients. We come up with whole plans, so it isn't just this piecemeal thing. So if you feel like your care is piecemeal, you don't necessarily need to have that, and you should have a comprehensive plan when it comes to your cancer care.
Well said. Thank you so much for being with us today, talking with us. Mary Alice, thank you so much for being with us today. Just your final thoughts. What do you want folks to know?
I want them to know that there is life after a cancer diagnosis, and to not waste time worrying about stuff that doesn't really mean anything. And I have to say that I've treated through the KU system since 2017, and I've been treated wonderfully by everybody that I've seen. And I have to say a great tool is MyChart, because I can go back and look at notes, and because you don't remember everything that you're told and some of it makes no sense. But I am happily on my way to maybe not recovery, but I'm sure living a pretty good life.
Thank you so much for sharing your story, and keep smiling. You look fantastic, and keep bringing us good Chiefs luck. We want you out there bringing the luck. All right, stay in touch, okay?
Well, thank you.
Thank you so much. Dr. Hawkinson, final thoughts?
Yeah, just a good question about vaccines today. We're still going to be looking for that information. Obviously, we know it's important for those populations that aren't able to be vaccinated, i.e. the young kids, to get vaccinated. That is the safest way to immunity. We're still looking for further information and guidance on if any adults or any certain ages need an additional 4th dose if you are not immunocompromised. So lots of good questions, insightful questions, and we will keep you up to date. We know the virus is still circulating, so just when you go out to celebrate today or this weekend or watch the games, just do it in a thoughtful manner and keep yourself safe.
All right, thanks so much. March 30th is National Doctors Day, and here's a way to say thank you to all healthcare providers. We know a lot of you in the community want to be able to show your gratitude. There on your screen right now is a QR code, so you can do just that. Just hover your photos over that. It will take you straight to your email. Just note that the videos need to be about 30 seconds long. You can send those videos, or you can send in a written message, and we would love to share those here on air. Well, they may not be doctors just yet, but college students aspiring to be a doctor can now take part in a new program starting at the University of Kansas Medical Center. It's called the Urban Scholars Program for students underrepresented in medicine. The program gives underrepresented students some help reaching their dream of becoming a doctor. To apply, you must have graduated from an urban high school in KCK, Wichita, Topeka, and Lawrence. You must be Native American, African American, Hispanic or Latino, or Cambodian, Latinan, or Vietnamese. So you do have until April 1st, though, to apply. So check that out. Cardiologists have been busy during the pandemic, and many have been treating those who have now survived long-haul COVID symptoms. That is the focus of today's episode of All Things Heart, which will start at 10 a.m. sharp. Host Alexis Del Cid joins me now from Studio B with a preview. Good morning.
Good morning, Jess. And we have a pretty alarming story. It's about a well-known and incredibly successful Kansas City woman named Terry Allen. She was a fitness instructor, a personal trainer, and a chef. Terry was at the top of her game 2 years ago at this time. Her brand was growing like wildfire. She was a regular on various lifestyle shows with her fitness segments. She was in the process of becoming a chef and opening her own food truck. It came to a screeching halt, everything, when she caught COVID in March of 2020.
Since the day I got sick, March 2020, I haven't taught a fitness class, have not trained anyone. I've worked out in a pool twice, but I'm so fatigued after, days of sleep. I usually will sleep 2 or 3 days.
It is stunning to see a woman as vibrant and vivacious as Terry simply brought to her knees by this virus. Coming up at 10 a.m., Terry will join us on All Things Heart, along with a cardiologist and an internal medicine physician, and we'll all be discussing Terry's post-COVID heart complications and the slew of other health problems doctors say they're seeing in a growing number of patients just like Terry, who survived COVID only to experience life-altering health complications long after the virus. So bring your questions and join us at 10 a.m.
Wow, that's going to be a great story. We look forward to hearing more about that, Alexis, and meeting Terry. Quite a story.
It sure is.
See you in a bit. Mm-hmm. Thank you so much, everyone, for being with us today. And don't forget, you can catch our program anytime. All right, so coming up tomorrow, medicine and healthcare, certainly not cheap. You add that to gas prices, food, housing, and people are now facing difficult financial decisions. Help is out there, though. Tomorrow, our panel of experts here at the University of Kansas Health System offer tips for managing your medical and other expenses during this very challenging time. Plus, a new program helping those in need of blood and food assistance, and you can help them out all at the same time. That's tomorrow at 8.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now, everywhere podcasts are available.